Menopause is a natural biological transition in a woman's life, typically occurring between ages 45 and 55, marked by the permanent cessation of menstrual periods due to declining ovarian function. This phase brings a drop in reproductive hormones, primarily estrogen and progesterone, leading to symptoms like hot flashes, night sweats, mood changes, and sleep disturbances. One of the most common and concerning changes for many women is weight gain, especially around the abdomen, often called menopause belly. Research shows that up to 60 to 70% of women gain weight during the menopausal transition, with an average increase of about 5 to 10 pounds, though some experience more significant gains. This weight gain tends to begin gradually in perimenopause, the 4 to 10 years leading up to menopause, and may continue into early postmenopause. While not every woman gains weight, the combination of hormonal shifts, aging, and lifestyle factors makes it more likely during this period. Importantly, menopausal weight gain is not just cosmetic. Excess abdominal fat, particularly visceral fat, deep fat surrounding organs, increases the risk of serious health conditions, including type 2 diabetes, cardiovascular disease, high blood pressure, stroke, metabolic syndrome, and certain cancers, such as breast and endometrial cancer. Understanding the underlying causes and recognizing early signs can empower women to take proactive steps to manage or prevent excessive weight gain. This comprehensive video explores the multifaceted reasons behind menopausal weight gain and outlines key early warning signs to watch for. Why weight gain happens during menopause. Weight gain during menopause is rarely due to a single factor. Instead, it results from an interplay of hormonal changes, age-related physiological shifts, metabolic alterations, and lifestyle influences. Contrary to popular belief, menopause does not directly cause weight gain, but it creates conditions that make weight maintenance more challenging. Hormonal changes, the primary driver. The defining feature of menopause is a sharp decline in the ovaries' production of estrogen, estradiol, and progesterone, with estrogen playing a critical role in regulating body weight and fat distribution. Before menopause, estrogen encourages fat storage in the hips, thighs, and buttocks as subcutaneous fat, resulting in a characteristic pear-shaped body. This type of fat is relatively less harmful metabolically. However, as estrogen levels drop during the menopausal transition, fat redistribution shifts toward the abdomen, creating an apple-shaped silhouette and increasing visceral fat, the deeper fat surrounding internal organs. Visceral fat is metabolically active, releasing inflammatory substances that contribute to insulin resistance and heighten health risks. Lower estrogen also influences brain centers that control hunger and satiety, disrupting key hormones such as leptin, which signals fullness, and ghrelin, which stimulates appetite, often leading to increased calorie intake. Additionally, declining estrogen impairs the body's ability to process starches and blood sugar effectively, further worsening insulin sensitivity. Declining progesterone, meanwhile, promotes water retention and bloating, causing temporary increases on the scale and a persistent feeling of puffiness. Large-scale research, including the study of women's health across the nation, SWAN, has consistently demonstrated that this menopausal transition is linked to greater central adiposity, abdominal fat accumulation, even when controlling for age alone. Age-related metabolic slowdown. Aging naturally slows metabolism, but this effect becomes more pronounced during the menopausal years. Women typically begin losing muscle mass, known as sarcopenia, starting in their 30s, at a rate of 3 to 8% per decade. Since muscle tissue is highly metabolically active and burns significantly more calories at rest than fat tissue, this progressive decline substantially lowers the basal metabolic rate, BMR, which is the number of calories the body requires for essential functions like breathing, circulation, and cell maintenance. By the time menopause arrives, the accumulated reduction in muscle mass makes it far easier to gain weight, even when eating habits and calorie intake remain unchanged. Additionally, overall daily energy expenditure decreases with age due to reduced physical activity levels, slower recovery from exercise, and a general decline in spontaneous movement, further compounding the tendency toward weight gain during this life stage. Sleep disruption and stress. Menopausal symptoms such as hot flashes and night sweats frequently disrupt sleep, resulting in chronic fatigue and diminished sleep quality. This poor sleep profoundly impacts weight regulation by increasing ghrelin, the hormone that stimulates hunger, while decreasing leptin, the hormone that signals satiety, often leading to overeating and higher calorie intake. Additionally, sleep disturbances elevate cortisol, the primary stress hormone, which actively promotes the storage of abdominal fat, particularly dangerous visceral fat. Midlife commonly brings heightened stress from career demands, family obligations, or caregiving responsibilities, further raising cortisol levels and intensifying visceral fat accumulation while triggering cravings for high-calorie comfort foods, creating a vicious cycle that exacerbates menopausal weight gain. Changes in body composition. Even if overall weight remains stable, body composition shifts. Fat mass increases while lean muscle mass decreases. This skinny fat phenomenon means higher body fat percentage despite no change on the scale, increasing health risks. Lifestyle and behavioral factors. While biology, particularly hormonal shifts, plays a major role in setting the stage for menopausal weight gain, lifestyle factors often amplify the issue and largely determine the extent of the gain. Reduced physical activity is common, as fatigue from disrupted sleep, joint pain, demanding midlife schedules, or diminished motivation can lead to less exercise and lower overall calorie burn. Dietary changes further contribute, with emotional eating triggered by mood swings, increased alcohol intake, which adds empty calories while impairing sleep quality, or greater reliance on processed convenience foods, often resulting in higher calorie consumption. Certain medications, such as some antidepressants used to manage menopausal symptoms or treatments for other midlife health conditions, can also promote weight gain as a side effect. Additionally, genetics influence susceptibility, with a family history of obesity or preferential abdominal fat storage, increasing the likelihood of significant gains. However, research consistently shows that while hormonal changes create the predisposition, lifestyle choices ultimately dictate outcomes. Women who sustain active lifestyles and maintain healthy eating habits frequently experience little to no menopausal weight gain. Early warning signs of menopausal weight gain. Recognizing the early indicators allows for timely intervention before significant weight accumulates. These signs often appear during perimenopause and may be subtle at first. Gradual, unexplained weight creep. Gaining 1 to 2 pounds per year without obvious changes in diet or activity. Clothes, especially around the waist, start feeling tighter even if the scale shows only a small increase. Increased abdominal fat. A noticeable shift in fat distribution, waist circumference increasing, development of a menopause belly, or moving from a pear-shaped to apple-shaped body. Measure waist circumference. Over 35 inches, 89 centimeters, in women indicates higher risk. Tighter clothing around the midsection. Pants or skirts that once fit comfortably now feel snug around the waist, even if hips and thighs remain the same. Reduced energy and increased fatigue. Feeling more tired than usual, making it harder to maintain previous activity levels, which indirectly contributes to weight gain. Sleep disturbances leading to cravings. Frequent night sweats or insomnia followed by daytime fatigue and increased hunger, especially for sugary or carbohydrate-rich foods. Mood changes and emotional eating, irritability, anxiety, or low mood prompting comfort eating or mindless snacking. Difficulty losing weight. Finding it much harder to lose weight through methods that previously worked, even with increased effort. Rising metabolic markers. During routine checkups, noticing increases in blood pressure, cholesterol, triglycerides, or fasting blood sugar. Indicators of underlying visceral fat accumulation. Bloating and water retention. Persistent feelings of puffiness, especially in the abdomen, due to hormonal fluctuations. Muscle loss and reduced strength. Noticing decreased muscle tone, strength, or endurance during daily activities or exercise. These signs are often mistaken for normal aging, but when clustered together during the perimenopausal years, they strongly suggest menopausal influences on weight. Health implications. Excess menopausal weight gain, especially the accumulation of abdominal fat, significantly elevates the risk of several serious health conditions, including type 2 diabetes due to increased insulin resistance, cardiovascular disease and stroke, high blood pressure along with abnormal cholesterol levels, and osteoarthritis from the added stress on joints. Additionally, it is associated with a higher likelihood of certain cancers and can profoundly impact quality of life, often leading to reduced self-esteem and diminished sexual function. Conclusion: weight gain during menopause is common but not inevitable. It stems primarily from declining estrogen levels causing fat redistribution to the abdomen, combined with age-related muscle loss, slower metabolism, disrupted sleep, stress, and often suboptimal lifestyle habits. By understanding these mechanisms and recognizing early warning signs, such as gradual abdominal weight gain, tighter waistbands, fatigue, sleep issues, and mood-driven eating, women can take early action. Strategies like regular strength training, adequate protein intake, stress management, quality sleep, and mindful eating can effectively counteract these changes. Consulting a healthcare provider for personalized guidance, including potential hormone therapy evaluation, can further support weight management during this transition. With awareness and proactive steps, many women successfully maintain a healthy weight and well-being through menopause and beyond.